Good day, everyone. It's Jessica again, and today we're going to be talking about when to get tested and how to get tested. So, you need to get tested if you are displaying any symptoms. Generally, displaying any COVID symptoms would be a good reason to get tested if you believe that you've been in contact with someone who's had COVID. So, if you are displaying symptoms and you've been in contact with someone with confirmed COVID-19, you've traveled to a high-risk country, you've worked or been in a healthcare facility that treats COVID-19 patients, or you have severe pneumonia with an unknown cause, then you must go and get tested. So, if you have symptoms plus any of those points, then you go and get tested. If you just have symptoms of a flu, do not waste your time or people's resources to go and get tested. It's very likely you just have flu. But if you know for a fact you've been in contact with someone who has COVID and you're starting to experience flu-like symptoms, that is when you get tested. Before getting tested, you generally will have to consult a medical practitioner for them to refer you to a testing facility to get tested. So there are private facilities that you can get tested anyway. However, in these situations, you will need to pay for it yourself. And if you're going just because you're displaying symptoms, you generally won't always be allowed to get tested. You need to have a referring doctor, or you have to have been in contact with someone. But because you are paying for it personally, you generally do not need a referral. Those are also the places where you can get tested for traveling, flying anywhere. You can get tested at those places because you're paying. Right now, PCR tests have been decreased from 850 Rand to 500 Rand, which is a big difference, especially for people who fly often or who constantly have to get tested. So if you go to, there are two labs that I believe are doing this at the moment. It's Lancet and Ampath. So those two labs have decreased their PCR testing from 850 Rand to 500 Rand. Now, the PCR testing is when they take a swab and they insert it up into your nasal cavity or into your pharynx to get a swab of the mucus or anything that's there, and that will then be looked at under a microscope and we'll see if there's COVID or not. So that's the PCR testing. Then you also have the rapid testing. Now, this is different. They take a drop of your blood and it gets put onto a little testing device that will test for antibodies for COVID. Now, this is generally not as accurate. However, the rapid testing, if it is positive, it means you definitely have COVID. There's no other way. If it is negative, however, it doesn't mean that you don't have COVID. It might just be a false negative, or you might not have COVID. So generally, if you have a negative test, a negative rapid test, and you still believe you have COVID, you will then go for the PCR test, which is the swab. If it comes back positive, your rapid test, then you know that you have COVID and you don't need to go for the PCR test. So, now we'll talk about how you get tested. You need to consult a medical practitioner over the phone and follow their instructions. Remember, you cannot just go to a doctor's office if you think that you have COVID. If you have COVID, you will spread it to almost probably everyone that you come into contact with in that office. It's a closed space as well. You need this medical referral to be tested if you don't want to pay for it. So if you want to go to the public hospitals, you will need a medical referral. Finally, if you want to be advised on any testing facilities, in South Africa, there is a number that you can phone. This number is 0800 029 999. 0800 029 999. That is the number you can phone in South Africa to be advised on where you can go and get tested. I hope that this information was helpful, and have a great day.